here. Happy Friday. Hope you all are doing well. Welcome to my Facebook Live, where today I'll be talking about something that's oftentimes misinterpreted or misdiagnosed, which is what's the thing that's causing your back pain to occur? What's the thing that causes your back to go out? So, I see patients all the time that say, hey, I was living my life, I was doing my thing, and then all of a sudden my back went out. Or, I was bending over to lift a piece of paper that fell on the ground, and all of a sudden I had severe pain in my back, and I was debilitated, my muscles were spasming, I was down on the ground, down for the count. So, why does that happen? What occurs? And quite frankly, what is it that your primary care doc or your emergency medicine physician is going to tell you when your back goes out that actually might not be correct? So today I'm going to be delving into that, going through the details and explaining what is and is not true when your back spasms or goes out on you. So I'm going to describe a scenario, and it may or may not sound familiar, but I'm going to describe it. And, if this rings true to you, then this is going to sound really, really familiar. But a lot of times I see when, we're working out regularly, we're lifting weights. I've had young patients that are active, that are healthy, that are doing things like squats and deadlifts and doing that without pain, not having any issues whatsoever. Or, maybe you've had some little aches and pains, in the past. Maybe you've had little things going on in the past, but you haven't had pain in a long time. But then you go and do something, and it's something benign, something really nothing big at all, and all of a sudden you have a significant back pain, sharp, right in your back. All of a sudden your muscles tighten up, spasm, and you can't get off the ground, right? You can't move. You're stuck kind of in a position, and you can't even straighten up your spine because the pain hurts so bad. Now, a lot of times this happens with, as I mentioned, just bending over to pick up a piece of paper, or bending to tie your shoelace, or lifting something small or benign. It's not that that action causes damage. In fact, it's very common that something was already going on there, but it feels like a sudden damage occurred, and now we're really in severe pain. So what do? If you rest, you lay down, you try to massage, or you take some medications and try to let that settle down. But if it's not settling down, sometimes the pain is severe enough that you actually go to the emergency room, or you go to your primary care doctor. And what do we hear when we go there? Oh, it's a back spasm. Oh, you pulled a muscle, right? The most common thing that you hear when you go to your primary care doctor, or when you go to your emergency physician, when you have severe pain that's occurring in your back, is that you pulled your muscle. So common that that's usually what people think occurs anytime that you had back pain, even regardless of what's causing it. So what is a pulled muscle, and quite frankly, why is that incorrect? When we talk about the muscles of our back, we have muscles, you have small little tiny muscles that are in charge of stability of each segment of your spine. You have bigger muscles, all of which are the paraspinal muscles that go up and down your spine. Then you have bigger muscles that kind of wrap around and make up the core of your back. And these muscles are really strong because they have to keep you upright for your whole life, right? So they're really strong muscles. A pulled muscle occurs when there's a sudden trauma to the back or to any muscle, right? That sudden trauma can cause micro tears inside the muscle or inside the tendon that attaches the muscle to bone. And that's called a strain, or a pulled muscle, or a pulled tendon. But for the muscles of the back that are actually strong, really supportive muscles, it would take a significant force to actually pull or strain those muscles. So I'm talking about a car accident. I'm talking about suddenly falling and really wrenching the back. Can be some things that actually cause damage to the muscles themselves. But if you're bending over to tie your shoelace, or if you're bending over to pick up a piece of paper, that's not an action that can cause a severe pain or a severe damage to the muscle or tendon, right? That's just not something that makes sense. But what is it that's causing this discomfort? And why does it feel like it's the muscles, right? Well, in reality is that more often than not, there's already some kind of irritation that has taken place that's deeper than the muscles. And what we feel when our back goes out is actually the muscles reacting to it. So what do I mean? Well, first and foremost, let's dig a little bit deeper into the anatomy of the spine. So this is a model of the spine. When this is just two segments of the spine. When we're looking at, these are the vertebral bodies, the bones, and these are the discs in between. In the back here we have the facet joints, and that's where one bone meets another bone, and that's where the motion takes place. Okay? And in between the disc and the facet joint is where the nerves exit and go down our legs in different distributions. But really paying attention to this disc here, this disc is like a water balloon completely filled with jelly. Rather than just a normal balloon, though, you may have heard me say this before, a disc is like multiple layers of rubber and then the jelly on the inside. So that disc, essentially, if you could picture that, when it's nice and filled with jelly, right, when we're teenagers or younger, when that disc is nice and healthy, that's nice and cushiony, right? As we get older, in general, we get a little bit of dehydration that takes place, or what's called degenerative disc disease. And that degenerative disc disease, I hate the word disease added onto that because it's a super common thing that occurs as we get older. Really all that it is just some dehydration or a little bit less fluid inside the disc, inside the water balloon. So when that occurs, instead of that water balloon being nice and cushiony, it starts to get a little bit more wobbly. And that in itself doesn't cause pain. That really, disc degeneration does not necessarily cause pain. However, with that increased wobbliness, if we do something abnormal, it can increase the chance of some tearing to occur in the rubber of the rubber balloon. So remember I said it's multiple layers of rubber and then the jelly on the inside. Sometimes the rubber itself can get a tear in it, and that's called an annular tear. Now, what's the thing that causes that tear to occur? Well, if we put a sudden pressure into the disc, if we cause a sudden shear to the disc, that's what can cause the disc to tear. And what causes the most pressure into a disc is if we are bending, and particularly if we're bending and twisting under load. So if our core muscles aren't firing properly, and if we are putting ourselves into an awkward position, that can cause a tear inside the disc. Or if you already had a little tear in the disc from an injury in the past or something along those lines, a disc tear doesn't necessarily equal pain, but if we then put ourselves in an awkward position, a pre-existing disc tear can get irritated or inflamed. And that disc tear, number one, can cause a sudden, severe, sharp pain in the back. And number two, when we have a disc tear occur, our muscles then have the tendency to kind of freak out. Our muscles are like, holy crap, that disc just got injured or irritated. Let's tighten up in order to try to take pressure off of the disc. And that muscle tightening up in reaction to the disc tear is oftentimes the thing that we feel when our back spasms or when our back goes out. Because it's those muscles that are uncontrollably tightening up. Poor muscles are trying to do their job, but those muscles are uncontrollably tightening up in order to try to take pressure off of the disc tear. So when we look at the disc, when you look over here, you can see that little red mark inside the disc. That's kind of a dramatization of what a disc tear looks like. I don't think it's actually red, but that is what a disc tear can be, and that's the thing that can, number one, cause a severe amount of pain, and number two, reflexively cause the muscles to tighten up or spasm. So then we feel our muscles tightening up and spasming, and what do? We go to the emergency room and they say, hey, your muscles are spasming because they got pulled and then they give a prescription of a painkiller. They give a prescription, maybe an anti-inflammatory by mouth, or sometimes a shot of anti-inflammatory in your butt. And they'll oftentimes give muscle relaxants to calm down the spasm of the muscles. So you decrease the inflammation, you decrease the pain, you decrease the muscle spasm, and after a few days the pain then decreases, it subsides, and then you go about your day, right? And that could be it. Sometimes that's it, and you could be perfectly fine and you don't have any issues for the rest of your life. However, if you start noticing that your back is aching, or these occurrences, these flare-ups, these back spasm episodes are happening more frequently, that's because that disc is still torn. And you do something that causes irritation to that, and then again, the muscles freak out and tighten up. So what do we do about it? How do we address this situation? Well, the first and probably most important thing that we can do is actually make sure that we're moving correctly. So the first treatment that I often recommend to patients in this type of situation is physical therapy, strengthening exercises, right? Really focusing on strengthening the core muscles, strengthening the muscles of the buttock, of the low back, of the abdomen, really ultimately to take pressure off of the disc, to take pressure off of that irritated region, and ultimately to get the body moving correctly. Because bending forward, sitting, even doing like Olympic lifts, things along those lines can be perfectly fine and healthy even if we have a damaged disc, as long as we're moving correctly. If we try to if we have a disc injury and we try to do a squat, and we really do a deep, deep squat and we have a ton of weight over us, then that can exacerbate a disc injury. But if we have appropriate weight, we have appropriate form, and we do a squat, then our spine is resilient. We can do things like that and have no pain associated with it. We have to be moving properly. So working with a trainer, a physical therapist, a personal trainer, a coach to really make sure that you're moving correctly ends up being so important. So what happens if you can't move correctly? What happens if your physical therapist is saying, hey, you know, your glutes just aren't firing, or you know what, your muscles around your low back are not activating, they're not firing? Well, in those circumstances, we want to get to the root of that problem. We want to make sure that we're addressing, you know, the ligaments, the muscles, the discs, the nerves, all of those things in the low back may be contributing to your body not moving properly, and that's where I come into play. So if you have a situation where the physical therapy is not enough, the exercises is not enough, right, then maybe it's a situation where the nerves just aren't firing properly because the disc is injured. And maybe, you know, doing a local focal injection of your body's own blood platelet growth factors, or PRP, could help with calming down the inflammation of the nerves, calming down the inflammation around the disc tear, and getting the nerves to fire properly. That kind of treatment in combination with the appropriate exercise can get us longer lasting relief. And if there is still substantial pain coming from the disc tear itself, we can inject directly into the disc tear with a patient's own bone marrow stem cells and actually try to strengthen that disc, decrease the inflammation around that in that disc tear directly, and potentially even heal that disc tear, and all with long-lasting relief. Just yesterday I saw a patient who had his back going out regularly. We treated that disc tear specifically. We treated the nerves. We treated the joints, the ligaments, the muscles, all things around there. And he stayed diligent with his exercise and his rehab protocol, occasionally getting some chiropractic adjustments to make sure he was in a good position and have that maintenance. And he's still sitting at over 75% improvement, and we're over a year out from his procedure. So we definitely can get long-term lasting relief. The very first line of treatment is guided exercise, often by a physical therapist. And again, if we're not getting the benefit that we need, strengthening all the surrounding ligaments, soft tissue structures, getting the nerves to fire properly, getting the disc to decrease in inflammation. All of that could be really, really beneficial. So I hope this was helpful for you. I hope this was informative in helping you understand that, you know what, when you have your back go out, it's not your muscles being pulled. It's not that you have a tear inside your muscle or anything along those lines. Your spine and your muscles are actually resilient. They're strong. And there's things that we can do with just exercise to get the body moving correctly and take pressure off of those areas. And more importantly, we can use your own body's healing abilities in guided, specific injection treatments to strengthen tissues, to decrease inflammation. And we can do that without avoiding surgery, and without resorting to things like opioid pain medications that really are only a Band-Aid. So I hope this was informative for you guys. If this was informative, please share it, like it, and if you have any questions or concerns, please feel free to comment, DM, or email us at info@fxregencenter.com. Have some comments here. Patty Miner says hi. Hi, Patty. Thank you so much for joining us. It's always fantastic. And Dr. Ryan Reeves has joined us. Thank you so much for joining in. Included a link to the Spine Intervention Society, a great medical professional society talking about the appropriate care with things like epidural injections. Thanks so much for the information. If you have other information to share, please, by all means, comment. Again, share this video if it resonated with you. I wish you all the best. Have a great weekend, great rest of your Friday. And if you do have any questions or concerns, feel free to hit me up. Wishing you guys the best.